In this video, we will discuss systolic murmurs. So what's a heart murmur? A heart murmur is an abnormal sound produced in the heart which is longer in duration than the opening snap, ejection click and mid-systolic click. A murmur may be systolic or diastolic, or according to the shape, it may be crescendo where there is progressive increase in blood volume passing through the defect, decrescendo where there is progressive decrease in blood volume passing through the defect, or it may be a combined crescendo and decrescendo, or a diamond-shaped murmur, or a plateau with the same intensity. So let's discuss the systolic murmurs. A systolic murmur may be ejection systolic murmur, mid-systolic, late systolic, or holosystolic or pan-systolic murmur. So let's discuss ejection systolic murmur. The ejection systolic murmur begins with first heart sound and ends in the mid-systole. This ejection systolic murmur beginning with the first heart sound and going towards mid-systole. The causes of ejection systolic murmur: ventricular causes, small VSD and or a large VSD with pulmonary hypertension. They result in ejection systolic murmur. Number 2, acute mitral regurgitation with non-compliant left atrium causes loud early systolic murmur. Number 3, tricuspid regurgitation in narcotic addicts causes early systolic murmur that occurs due to endocarditis. Why narcotic addicts develop tricuspid regurgitation? Contaminated narcotic injection in a peripheral vein directly reaches to the tricuspid valve and damages it. Now, mid-systolic murmur. Most benign functional murmurs are mid-systolic that originate from pulmonary outflow tract. In a young adult with a thin chest wall, a moderate mid-systolic murmur only in the pulmonary area is innocent murmur, but a louder murmur in the aortic area indicates congenital aortic stenosis. Echocardiography differentiates functional from pathological murmur. Aortic stenosis is the prototype of left-sided mid-systolic murmurs. Aortic systolic murmurs are common in acquired aortic stenosis. It also occurs in aortic dilatation in elderly, non-stenotic thickening of the aortic valve leaflet. Aortic stenosis murmur is loudest in the second right intercostal space and radiates to the carotid arteries in the neck. But when aortic valve becomes immobile due to calcification, A2 becomes soft or disappears. Often crescendo, decrescendo in shape, they start shortly after the first heart sound, get louder, and then diminishes as ejection declines. Murmur decreases in intensity and ends before the closure of the semilunar valve or before the second heart sound. What's Gallaverdin phenomena? Aortic stenotic murmur disappears from the right second intercostal space and appears at the apex beat area, mimicking mitral regurgitation murmur. This is known as Gallaverdin phenomena. Other causes of the mid-systolic murmur are ventricular obstruction, valvular or subvalvular cause mid-systolic murmur. What's the difference between aortic stenotic murmur and hypertrophic cardiomyopathy murmur? In hypertrophic cardiomyopathy, mid-systolic murmur is maximum at the left lower sternal edge and apex beat area and very little radiates to the neck. So that's the difference. The hypertrophic cardiomyopathy murmur is at the left lower sternal edge and the apex beat area, whereas the aortic stenotic murmur is in the right second intercostal space and that radiates to the neck, whereas cardiomyopathy murmur does not radiate to the neck. Where does mitral regurgitation murmur radiates? Mitral regurgitation murmur is loudest at the cardiac apex and left sternal border and radiates to the base of the heart or to the axilla and back. When posterior mitral leaflet is involved, it radiates to the left sternal border and to the base of the heart. And when anterior leaflet of the mitral valve is involved, then it radiates to the axilla and to the back. So when posterior mitral leaflet is involved, the murmur radiates to the left sternal border and to the base of the heart, and when anterior leaflet of the mitral valve is involved, then it radiates to the axilla and to the back. Now, late systolic murmur. Late systolic murmurs are high-pitched, apical and moderately loud murmurs. So why do they occur? They occur due to papillary muscle dysfunction. When does the papillary muscle dysfunction occur? It occurs after myocardial infarction, ischemia, left ventricular dilatation, diffuse myocardial diseases, and during the angina pectoris. The late systolic murmur occurring after these conditions due to papillary muscle dysfunction. The late systolic murmurs that occur after mid-systolic click is due to mitral regurgitation due to mitral valve prolapse into the left atrium. Now, holosystolic or pansystolic murmur. This is the holosystolic or pansystolic murmur where the intensity of the sound remains same throughout the systole, starting from the first heart sound and ending at the second heart sound. Holosystolic or pansystolic murmur is a high-pitched blowing murmur in which blood flows from high-pressure chambers to low pressure chambers throughout the systole. For example, between right and left ventricle, if there is a ventricular septal defect, and between right atrium and right ventricle in tricuspid regurgitation, and between left atrium and left ventricle in mitral regurgitation. Causes I already told: mitral or tricuspid regurgitation and ventricular septal defect. What's memory shuffle? An innocent systolic or continuous murmur that occurs over the breast area during late pregnancy and early postpartum period. What's a presystolic murmur? Presystolic murmur is a late diastolic murmur. This is the presystolic or late diastolic murmur. This is not a systolic murmur, it's a diastolic murmur and causes loud first heart sound.